Hi, it's Dr. Ann Zink. Today is December 11th and providing a brief update with where we're at with COVID-19 in the state of Alaska. On our dashboard, you can see that cases continue to rise. Unfortunately, we do have another 613 cases today. And you can see that most regions are continuing to escalate and all regions are in the higher alert red level. We are starting to see some regions starting to plateau off. And I think that's because of a lot of hard work of Alaskans wearing masks, keeping their distance, washing their hands, and really using these mitigation tools to slow the spread overall. We have some additional data that wanted to share based on race and ethnicity, including hospitalizations, deaths, as well as cases. So if you look at the orange bar here, that's the percent of Alaskans that are in each of those categories. And then you can see the categories based on how many people have died, hospitalizations, or cases. Unfortunately, we're starting to see a real variation, and Alaska Natives really are taking a disproportional hit with COVID-19, making up 37% of our deaths, 27% of our hospitalizations, and 20% of our cases, while they only make up 16% of our population. We also see a disproportionate burden of disease on our Native Hawaiian and Pacific Island populations and continue to try to find ways to make sure that people are safe, taken care of, and protected, as well as have the resources they need to be well and healthy. You can see on this next slide that all states are really surging at this time. Some are starting to slow down, but most places in the United States are really having a lot of cases as we all continue to try to push these curves down and continue our same goal, and that's really flattening that curve and keeping underneath our hospital capacity. Here's our percent positivity, well over 1 million tests now. Again, each of these tests is an individual test, but some people get tested more than once. However, each case is an individual person, and if they get tested more than once, we only count them once in our cases. Right now, we're at about 6.5% positivity over the last 7 days. It's been great to see this not climbing, but we'd really like to see that less than 5%. We get that percent positivity down by doing two things. The first of which is minimizing the spread of COVID-19. Again, all of those mitigation factors. The second way we get it down is to make sure people test early to make sure that we can identify cases and prevent the spread to others. And so those two things need to happen to get that a little bit lower so that we can really get on top of this disease. I also want to highlight the fact that we've seen the percent positivity really skyrocket at the airport testing. Right now, we estimate that 1 in 16 passengers who test upon arrival are positive with COVID-19. It's a lot of people in the air that you might be sitting next to. I also wanted to highlight this, and this is a new report that came out from the CDC, really highlighting public health strategies to address high levels of community transmission of the virus SARS-CoV-2 that causes COVID-19, as well as related deaths. It's a short but really good read and talks about the importance of wearing a mask, maintaining your distance, avoiding gatherings, isolating cases quickly, protecting high risk groups, vaccinating widely, washing your hands, avoiding travel, the contact tracing work that we've been doing, as well as protecting healthcare workers. So it's a short, good read, and I'd encourage everyone to take a look at it. We've learned a lot about COVID-19, and we have a lot of new treatment options that we didn't have before. There's two different medications that are monoclonal antibodies, kind of artificial antibodies that help you to fight and protect against the virus. These look like they work best in high-risk patients early on in their symptoms, and many hospitals are administering them, but we've also set up an infusion site in Anchorage to help assist hospitals given how full they are right now. This has been temporarily set up under this emergency use authorization, but you do need a referral from your provider before you are able to come. The big exciting news is that vaccines are right around the corner. Even as we've been filming this, there's new information coming out about vaccines, and we as a state are here to help support the allocation and rollout as soon as the data information is fully there. Currently, we're pending the FDA authorization for emergency use for the Pfizer vaccine, and we anticipate a week later the same discussion to be happening about the Moderna vaccine. If all goes well, we expect a shipment of 35,100 doses from Pfizer, followed by a Moderna shipment of 26,800 doses. I want to highlight that this seems a lot more than many other states, and that's because we're getting our entire December allocation up front, while many other states are getting it on a week-to-week allocation. And that's to help overcome some of the significant logistical challenges we have in trying to get the vaccine out to everyone in the state who meets criteria for that first phase 1A criteria. I will also note that this includes not only state allocation, but IHS allocation that is going to be distributed to them. We also have over 300 providers enrolled to help distribute vaccine and really appreciate their partnership and time that they've put into being enrolled providers. So who gets the vaccine first? That's the question I get asked all the time. I like to think of it as kind of these nesting dolls. We get recommendations from the ACIP to be able to tell us who would benefit the most. We then have a state allocation committee that takes those same recommendations and helps us to be able to figure out logistically how to make that happen. And that goes all the way down to the community level. Say a hospital might say these are our highest risk exposed individuals, all the way down to the individual level, with individuals making that decision themselves if they want to take the vaccine. We want to make sure that you've got the data and science to support your decision. And so I'd really encourage people to take a look at our website. We'll continue to increase information as it comes out as quickly as possible. There's been some great articles published even in the last 24 hours. I want to make sure that's out and available for the public. I will say that the Phase 1A group includes long-term care facility and staff, as well as hospital-based frontline healthcare workers at highest risk for COVID-19 infection, EMS and fire personnel providing emergency services, community health aides, as well as health practitioners, as well as individuals who are able to perform vaccination. We continue to work through the Phase 1B grouping and continue to follow the CDC and other guidelines based on the science and data. I also just want to emphasize that we have a new website out. We tried to make it cleaner and easier to use and looked at what you took a look at the most. Have gotten some great feedback from you all and have made some changes already. So take a look at the new website. Let us know what you think, what you've missing, what you've got, and there's a bunch on there. But as we enter into the darkest part of winter, and honestly, the darkest part of this pandemic, remember that there is much hope. This is going to be a really challenging few months, but we are getting near to a much better place and an end. So come join us on December 20th, where we're asking all Alaskans to unite from a distance at 5 p.m. Step outdoors, bring a candle, share a flashlight, and think about all the ways that we've been able to be resilient and strong together as we try to really push that curve down, keep underneath our hospital capacity, protect each other, and move forward as we enter into a new phase of this pandemic. So be well, keep your masks on, your distance up, minimize your gatherings, take care of each other, be well, be kind, and we'll talk soon.